welcome to Tuesday Tips. My name is Pam Dunwald. Have you ever had a loved one, whether it's an aging parent or another loved one, go to the hospital? Maybe they have to go from the hospital to the nursing home, maybe for short-term rehab. Maybe they had a hip replacement or a knee replacement. They go to the nursing home for a few weeks and then they go home. And you think that all the healthcare professionals know exactly what's going on and the transition is smooth, everything goes as planned. I can tell you that those are what we call transitions of care, when you go from one type of care to another. For example, it could be to a doctor's office and home. It could be to a hospital and home. It could be to a nursing home and home, or it could be a combination. Each one of those transitions in care is an opportunity for a nightmare and of errors and mistakes in the treatment plan. It is the most critical time in a patient's um, transition, I guess, for lack of a better term, is when they're going from one type of treatment to another. Again, my name is Pam Dunwald, one of your nurse advocates from Your Nurse Advocate Consulting. And just want to say hi to everybody in the forum. We have a free community forum that everyone is welcome to join us. And every Tuesday we go live and we just talk about caring for your aging parents. Our forum is speaking out on aging parents. So check that out. We'd love to hear from you. Love to hear some discussions on what's going on. We'd love to share some tips and strategies. But today we're focusing on why transitions of care is such a critical part in your aging parents' transition from a care facility to home. And we're going to talk a little bit about what are the most common errors and some tips and some strategies that you could do to try and help and make that transition go smoothly. So let's think about this. So when someone is in the hospital and they're being discharged home, what goes on during that stay? Well, it depends on what they were admitted to the hospital for, but there's probably going to be some changes in medication. Let's take something that should be relatively, or that we feel should be relatively simple. Let's take your aging mom goes to the hospital for a knee replacement. And a lot of times the orthopedic surgeon will have a lot of the medications and things set up before prescription wise before they go. But let's say, for example, your aging parent is not going to be able to go home. You live in another state. Your aging parent lives home alone. They've lost their spouse in the last couple of years, and they don't really have anybody that can stay with them. And a knee replacement is, you've got to work that knee. It's some pretty intense therapy that needs to occur in order to keep and maintain that function of that knee once that surgery is done. So the plan is for your aging parent to go to a nursing home, short-term rehab, 2 to 3 weeks, and then go home. All right. So now you've got what went on in the nursing or in the hospital. Say they had some problems with their blood pressure after anesthesia, after their surgery. So maybe they adjusted their blood pressure medicine. Now, normally they're put on some kind of a blood thinner when they are after they have a joint replacement surgery. A lot of times they like to use, one of the newer ones like the Xarelto or the Eliquis. Those blood thinners do not need blood tests to be done. You don't have to there's no dietary restrictions, unlike the warfarin or the Coumadin that people used to take. Now, these are new medications. They're not generic, so they're super expensive. So sometimes the insurance formulary will only approve one or the other. So we have to make sure that that's taken care of. And then when we go to the nursing home is responsible for providing those medications. Is the nursing home going to provide those high dollar medications like the Eliquis or the Xarelto? That's something a lot of times they do, but there's an opportunity there for an error. Maybe maybe the wound opened a little bit, which can happen, and now there's wound care orders. Well, what they're doing in the hospital, when they leave the hospital and go to the nursing home, they have discharge instructions. They have a list of the medications, and in the case of a nursing home, they usually get a doctor's discharge summary, and that lists the medications and that. Well, before they even leave the hospital and go to the nursing home, a clinical pharmacist should reconcile the medication list, make sure that they're either back on their home meds or there's indications why some medications have been changed. So that gets sent to the nursing home. So we hope by the time that your loved one gets to the nursing home, all these things are worked out and they're correctly communicated to the nursing home. Well, now they're at the nursing home and they have to just transcribe all the orders. They have to put everything in. If it wasn't on the discharge summary, it's not gonna get put in as an order. So there's the second crack that things could fall through, whether it's the wound care orders, whether the medication orders, whether it's activity orders, therapy orders, whatever that care is supposed to be when they transition to that nursing home needs to be communicated correctly to the nursing home. And then the nursing home has to correctly transcribe it into their orders and into their system so that everything is right. Now you're going to go home and your loved one now is going home and they're looking at their blood pressure medicine and they're thinking, well, that's not what I normally take. That's not what my doctor says. Here's my paper from the clinic that was gotten maybe 2-3 months ago when they had their physical for having the surgery. Look, this is my medication list from the clinic. I'm not supposed to be taking this amount of my blood pressure medicine. I don't know where they got that from, but this is wrong. I'm going to go back to taking what I was taking before. All right. So there's another opportunity for a mistake. The blood pressure, the medication was increased in the hospital. They're having higher blood pressure after surgery. That, new blood pressure, medicine, the dosage was carried over to the nursing home, but now they're going home and they're back home. They want to get back to their normal routine. And this is what they know. And so somewhere in the process, it was not communicated well enough, or it wasn't in writing, or someone said, now, this is a new dose for your blood pressure medication. So you're not to take the old one. So then they will have a follow-up with their doctor, usually a couple of weeks, a month or so after they get out of the nursing home, and they go in and they say, oh, they told me when I was in the nursing home, I'm supposed to take this much blood pressure medicine. And the clinic looks in their clinic record because their clinic record doesn't talk to the nursing home's record. And they say, this is what your normal blood. I don't know why they did that. Oh, that must have been something in the hospital. Well, okay, go ahead and go back. Well, now you've got a confirmation that you should be on this other dose, but really, should you be on this dose? And is your blood pressure going to go up? And is there going to be problems? I mean, you can see just by this this is a very simple story about how you can go down all these rabbit holes and there could be so many mistakes along the way. So what do you do with this mess? And I've been, out of my 40 years as being a registered nurse, I've spent 20 of them in a hospital setting and then in other settings where people were being discharged, even in home health, when I worked in home health and hospice. In home health, we were discharging the patient from home health to no services anymore. So now there is a transition. Everything that we were doing in home health, are they carrying on doing the same thing? So all of those things are transitions and are, just breeding grounds for mistakes. So what are some of the things that we could do? Number one, I highly recommend that the loved one is not the only one that's receiving any kind of discharge instructions from any of those places, whether it's the doctor's office, the hospital, the nursing home, assisted living, or home health, or whatever. Always, someone else should always be present, even if it's just by phone. If you live out of town, and they're being discharged from the hospital, ask the hospital, hey, put me on speakerphone. I want to hear the discharge instructions so that I can follow up with my loved one and make sure that they understood correctly and they can implement the changes that were started from their hospital discharge. So that's the first thing you do, is make sure you know what those discharge instructions are. Be part of their patient portal, though, on like the My Chart or whatever your clinic has. Not only have their login and pass, but have your own, so you can get email messages. You can be in communication. You can see, the doctor's notes and things like that. So same thing from the nursing home. If they're going home from the nursing home, what services are they going to need? Do they need any services going for the nursing home? Are you concerned about them bathing themselves or getting meals? Is there a conversation that needs to be had with that social worker before they leave the nursing home? So communicating with all the professionals and sharing your concerns. No question is a dumb question. Just, advocate for your loved one, ask all those questions, and make sure that you're satisfied with the answers. So, again, compare medication lists. If there is a change and you notice a change in their list that they had prior to going into the hospital, and it's not the same as it is when they get home, ask questions. Make sure that you understand, beyond a shadow of a doubt, that you have a reasonable explanation why those medication lists don't match. Same thing for treatment. Whether it's wound care, whether it's going to outpatient physical therapy, or any of those things, you want to make sure that you are confident that they are in the right place at the right time, doing the right treatments and taking the right medicines. Uh, you know, Transitions, I mean, this is kind of a passion for me because there are so many opportunities for mistakes and so many things. I mean, we've had people go home from the hospital, and we, as a case manager in the hospital, if they're high risk for coming back, we may give them a phone call, once they're home from the hospital. I mean, we found out that patients have not even picked up their prescriptions after being hospitalized because it was too much money and they decided they didn't want to pay for it. So again, knowing, your loved ones, your aging parents' formulary and their insurance, what is covered, what's not, because if, they're on a fixed income, many of our seniors are, and if they think it's too much, they'll just say, oh, I don't need it. And, maybe they don't understand, the concerns, or understand that they really need to be taking that. So miscommunication, medication errors, um, what else do we have? Lack of professional oversight. Here's another one, and I don't want to say that in a mean or demeaning way, but what I'm saying is when someone comes home from the hospital, they should have an appointment to follow up with their primary care provider within 7 days. 5 to 7 days is optimal to make sure that they're doing okay after hospitalization, and making sure that they're trying to keep them out of the hospital and avoid from getting readmitted. Now, if your loved one goes home on a Saturday or Sunday, that clinic's not open. The hospital can't make that appointment for them. So a lot of hospitals, have different systems. Ours, it goes on a manual clipboard. It goes on a list for the ward secretary, the unit coordinator, to call and make those appointments first thing Monday morning. Well, what happens if that doesn't get put on that list? So that's another thing, is making sure that if you don't have an appointment, if your loved one, if your aging parent doesn't have an appointment to follow up with their primary care physician within 5 to 7 days after being out of the hospital, something's wrong. So either you can contact the social worker at the hospital or contact your clinic and say, hey, my loved one has just been in the hospital. We did not get a follow-up appointment. Can we make that? So that's what I mean by lack of professional oversight. And I'm just trying to think, I'm just looking at my notes here. Um, be intentional. And that's the last thing I'd like to say as we wrap up. Be intentional with your questions. Be intentional with knowing that there are all these opportunities for errors with these transitions of care. Knowing that this is a critical time and a lot of errors can occur, just be on high alert for all of these things that we talked about. For a deeper dive and for more questions, more concerns, more tips, more strategies, take a look at our newest blog post. It's out there. I'll put that in the notes here for the video, because that we really go into a little bit more detail than we do in this video, but we hit on the highlights. So advocate for your loved one. Know that going home from the hospital or a nursing home or even a doctor's office, there could be mistakes that are made or things that are missed. So do what you can to be proactive, and we'll see you back on the next Tuesday Tips. Take care.